Welcome to a brief presentation on the ARCP outcome and process. My aim is to show you the path to success at the ARCP. I will explain the process of the ARCP, inform you about the checklists that are available for the purpose of the ARCP. I will also explain the ARCP process for ST3 trainees during their out-of-hub year. The term ARCP refers to Annual Review of Competency Progression. This is a UK-wide process by which doctors and postgraduate training present information to demonstrate their progress in meeting the requirements set out by their respective Medical Royal College curriculum. Though the ARCP takes place at the end of the year, it is best to collect evidence through the year. Please engage in formative assessments, that is, assessments for learning, which are the workplace-based assessments or the supervised learning events, also referred to as SLEs. At the end of each module, these formative assessments, together with feedback from your consultants, allow your clinical supervisors to sign you off for that unit. This means that they sign a form called a cut form or the completion of unit of training form for each module. In addition to this, 360-degree feedback from the members of your team shows that your training is fit for purpose. This multi-source feedback should be sought at least once a year. The ARCP is a summative assessment that takes place once a year at the end of your training year. The goal guide is the document that describes the overall purpose and approach to the ARCPs. It provides a detailed description of the educational assessment, and it emphasizes the role of the educational supervisor and the value of the educational supervisor's structured report. The purpose of the ARCP is to assess trainee achievement and learning with a view to assessing their suitability to progress to the next stage of training. If progress has been poor, trainees will be provided with feedback and a remediation plan will be facilitated. The ARCP process is meant to be fair, defensible, and consistent. We will document how trainees have been judged, and the ARCP process provides reassurance about the quality of medical training, and it also advises the responsible officers about revalidation for trainees. This slide shows that the ARCP process is one that actually extends throughout the year. Health Education England reviewed the ARCP process, and in their document on enhancing training and support for learners, they recommended that the ARCP requirements should be clarified at the beginning of the training year. You will find that for every stage of training, we have an ARCP checklist. I know that you may be either an ACCS trainee, a core trainee, or a specialty trainee. So for each category, there's a separate checklist. ACCS trainees belong to different parent specialties: acute medicine, emergency medicine, and anesthesia. So for the CT 1 year, there's a separate checklist for ACCS trainees. For emergency medicine trainees, there's a separate checklist for their CT2 and CT3 years, and similarly for acute medicine trainees. For anesthesia trainees, the Royal College of Anaesthetists has come up with a national ARCP checklist, and this is to ensure that uniform standards are applied throughout the country. This checklist is available on the college website and on our school's website. As you can see, the ESSR, which is the Educational Supervisor's Structured Report, must be completed on the Lifelong Learning platform prior to the ARCP. The first part of the checklist includes placement information, personal development plan, milestones achieved, and logbook. All of these provide evidence of your achievements and learning. The record of meetings with your educational supervisor and your progress with completing units of training provide evidence of your engagement with training. Feedback from your consultants and from other colleagues provide evidence of effectiveness of your patient care. I would like to draw your attention to the second section on this slide, which is Review Unit Progress. Now, this details the cut forms that you will need for each stage of training, whether it is CT1, CT2, or intermediate training, higher training, or advanced training. This slide shows you that section of the checklist that focuses on your revalidation. The Form R is key to your revalidation. It must be completed within a month of the ARCP. Failure to upload the Form R will result in an automatic Outcome 5. The checklist also provides guidance on how reflections should be written. This is particularly important after the high-profile case of Dr. Hadiza Bawa Garba. You can see the various ARCP outcomes that could be awarded. As you can see, the favorable outcomes are outcomes 1 and 6, unless you're out of program for some reason and you're awarded an outcome 8. This slide summarizes the steps in the ARCP process. It also shows you, it highlights the role of the trainees, the educational supervisors, and the importance of Form R in the ARCP process. Take a minute to look at it and see what you need to do to ensure that you get a favorable outcome at your ARCP. Where will I have my ST3 ARCP? If you are an ST3 trainee in Yorkshire, you will notice that your post has a designated hub, which is HH, LH, or SH, which means Hull Hub, Leeds Hub, or Sheffield Hub. You would have seen a 3-year rotation track that includes 1 year outside your hub. Your placements are designed to be within 60 minutes of the hub hospital. Please note that the distance between Hull Hub placements could exceed this. The 3 hubs are defined by the site of ARCP and by the location of their primary tertiary hospital. So, your hub could be either Hull, Leeds, or Sheffield. If you have taken a Leeds hub job, then your ARCP will be done by a West ARCP panel, even if your placement has been in Hull, York, or Sheffield. I would like to add more details on the out-of-hub ST3 year. The 3 hubs are defined by the site of the ARCP, and though the training may be different in the different sites and the hubs are individual, yet training is integrated. Cut forms that are signed off at one hub will be accepted by other hubs. My tips for maximizing your placement at a tertiary hospital are: if you do ICU on call at a tertiary hospital, example in Leeds, aim to complete your intermediate trauma module then during that placement. If you do obstetric on call at a tertiary hospital, example Hull, aim to complete your intermediate obstetric module at during that time. This slide shows you the reference documents. If you want to do some more reading about the ARCP process, I would recommend that you look at the Gold Guide. This is our reference guide, and we follow all the guidance that is given here. You can read section 4, pages 61 to 70 to see what we follow for the ARCP process. Further details about the ARCP and assessment processes can be found on our school website. You can find the individual checklist for different stages of training. You could also email your training program directors if you have specific questions. Enjoy your training in Yorkshire. Have a successful career, and thank you for listening.